Today is the 85th day in our coronavirus response in Kenya, and this is our 79th briefing. Fellow Kenyans, I want to start by sending best wishes to every Kenyan and their families, healthcare workers, well-wishers for their support and goodwill as we tackle this pandemic. It would have been extremely difficult to achieve the success that we have achieved without all of your support, and for that we sincerely thank you. The weapons that we have deployed in combating this pandemic have been various restrictions and other containment measures. And we are aware that these measures have radically altered our everyday lifestyles. However, the overriding priority has always been to cut the cycle of transmission, to save lives, to preserve livelihoods, and to create an environment that would allow the return to normalcy in the shortest time possible. As we soldier on, we are confident that the outbreak will eventually recede and the enemy will be defeated. It is important to note right now that as we hasten this defeat, it is important we adopt models of behavior that limit the movement of the virus and that eliminate transmission of this virus. And therefore, repeatedly, fellow Kenyans, we have stated that we must continue to regularly wash our hands. We must maintain social and physical distancing. We must wear masks and wear them properly and not on our chins. We must avoid social gatherings, amongst other measures. And these measures are important in ensuring that we continue to flatten the curve. It is important to note that collective effort in combating this pandemic requires that each and every member of society, irrespective of their condition or status, is able to partner with us in fighting for this virus, against this virus. I'd like to emphasize on the role of personal responsibility and to call on all of us to actively participate in aiming to contain the coronavirus 19 pandemic. And in this regard, there are members of public who've really made milestones in assisting us, particularly in Mombasa, where we've noted that there are initiatives now that have been put in place, good innovations that enable us to be able to test all members of the public, including vulnerable members and members who may have mental disability, are now being tested, and this is innovative through engagements with Mombasa County. And in particular, we would like to thank Mama Amina Abdallah, who is the chairperson of Mombasa Women Empowerment Network, who has actually come forward and really given us good support in being able to carry out testing amongst vulnerable groups, and we thank her for that support. We would like to also further reiterate that at the point where the pandemic is, and with the fact that we've established community transmission, it becomes important to ensure that county preparedness is now the key priority moving forward. And in this regard, as you all know, we are witnessing community spread, and county facilities therefore require to be ready to be able to contain this virus. We therefore appeal to counties to move with speed, to utilize the 5 billion Kenya shillings that has already been disbursed to them to ensure that they upgrade their health facilities in readiness of managing COVID-19 cases. Turning on to now our current COVID-19 situation, 134 people have tested positive from 3,177 samples that were tested in the last 24 hours. This therefore brings the total number of positive cases to 2,474, with the total samples collected and tested so far being 90,875. The positive cases include about 131 Kenyans and 3 other foreign nationals. Out of the 134 cases, Mombasa has 67, Nairobi County has 31, Busia 15, Machakos 5, Taita Taveta 4, Kilifi, Nakuru 2 cases each, Garissa, Murang'a, Kisumu, Uasin Gishu, and Kajiado each have 1 case. The cases are distributed in the following sub-counties as follows. In Mombasa, from the 67 cases, we have 25 in Kisauni, 12 in Jomvu, Changamwe and Mvita have 10 cases, and Likoni has 1 case. In Nairobi, the 31 cases are from Kibera, we have 19, Westlands 7, Makadara 3, Langata and Embakasi East 2, Ruaraka, Kasarani, and Embakasi South have 1 case each. And in Busia, all the 15 cases are from truck drivers at the border points. In Machakos, all the 5 cases are from Athi River, and in Taita Taveta, all the 4 cases are from truck drivers at Taveta. In Kilifi, the 2 cases are both one from Kilifi South and the other from Kilifi North. In Kiambu, 2 cases from Ruiru and Kabete, while in Nakuru, 2 cases from Naivasha. Garissa has 1 case at Dadaab, while in Murang'a we have 1 case at Makuyu. Kisumu has 1 case, and this is in Kisumu Central. And Uasin Gishu do have 1 truck driver from Turbo. Kericho has 1 case, and Kajiado has 1 case. And allow me perhaps to emphasize, the reason why we are disaggregating this data for you is to really establish and to inform members that this disease is now within our communities. Just from the statement that I've read, you can see we've literally touched on most of the corners of the country. And so we do need to really take personal responsibility. And in terms of gender, we have 98 of them being males and 36 being female, with the youngest being 6 years old and the oldest 70. Today, we are also happy to report we've discharged 51 from various health facilities, bringing our total number of recoveries to 643. And for these recoveries, we really do continue to express our appreciation and gratitude to all healthcare workers and to all Wazalendos who have really dedicated and been committed in terms of beating coronavirus. Sadly, we have lost 1 more patient to the disease, and this brings the total fatalities to 79, and our deepest condolences to the families of the departed. And finally, as we conclude, we would like to emphasize that it is important that we keep repeating the 3 take-home messages to all of you, which are, as you all know, please wash your hands often with soap and running water, avoid close contact, stay at least 1.5 meters away from each other, and please wear your masks and wear them correctly. Thank you for your commitment. Questions, please.
So with we want to find out how efficient is that plan, knowing that Kenyans have this tendency, have reverted back to their old ways by flouting the mitigation measures that have been put in place. So how sustainable is that, and how much threat will it pose to fellow Kenyans? Because someone who's asymptomatic will just interact freely with other people, and we won't be able to know that this person is sick or not.
Nancy Okwaro from KBC. My first question, you've mentioned that in Dadaab we have 1 case. So about 2 weeks ago you had announced 2 cases from the Dadaab refugee camp, especially at the Ifo and Dagahale camps. Is this new case a contact of those 2 cases that you had reported? And finally, you had announced that over 35 health workers are among those who have been infected with coronavirus. What is their status at the moment? Are there any who have already been discharged?
Angela Okech from Nation Media Group. One of the measures that the government had put in place to ensure that people observe social distancing was in most of the social gathering was to limit the number of people that attends to most of the social gathering, including funerals and weddings. And in one of the funerals today in Nyeri, we've observed that over 300 people have attended that funeral. And the limit number of people that the government had put in place was 15 people. So who ensures that these measures are adhered to? Thank you.
Okay, I'm Calvin, PC Band, which is a youth community.
Sorry, I can't hear you.
I'm Calvin. Okay, I'm Calvin, PC Band, a youth community-based organization, and I'm just from Kibera and Kawangware right now. I was creating awareness within those regions. And there is a big problem now, especially today, it is 2 hours more. The majority are not wearing masks, and it is like just, the life is just normal, like people have just returned to their normal duties. So I'm just asking, is there which action can we be able to reinforced there so that they can be able to put the mask. Because even near the police stations, you just see the people are not wearing masks. And you wonder what now can we be able to do, especially with people who are creating awareness.
Thank you. Let me address those questions. And one, to thank you really for being one of the wazalendos who goes and creates awareness. I think that perhaps is instrumental and really touches on what we feel as a Ministry of Health is the biggest, should I say, vaccine for coronavirus. Is essentially us taking personal responsibility, you partnering with us in terms of ensuring that there's awareness in the community. Now, this issue really has been brought to our attention many times. I think we've also interacted with it as we move around with the publics. And really what we are doing as a Ministry of Health is ramping up communication to ensure that Kenyans can truly understand why these measures are necessary. And I think in one of our past briefings, we've really emphasized and to a point even shared with you that this simple cloth that is in front of your mouth and nose can actually reduce the risk of transmission by 50%. That's how powerful a mask is, 50%. And if you can compute and look at our population in the country, you're really literally reducing risk of transmission by 50%. Now, when you add that on to washing your hands, that moves to 70% reduced risk of transmission. And so we do feel strongly, and this is voiced from both the Ministry of Health, but also globally with the partners who we are working with, that these three measures, simply wearing a piece of cloth in front of your nose and mouth, 50%. Washing your hands, 70%. Reducing that physical distance to 1.5 meters, again, adding another percentage point to reduce risk of transmission. So really, these are the measures, and what we can do, what each and every one of us can do, the 20 of us here who are here today, is really just be ambassadors for ensuring that Kenyans are able to adhere to these measures. I'm sure you all appreciate that policing 47 million people is a difficult task. Remembering also that there are other priorities and there are other key elements which our policing and security personnel would need to attend to. And so what we need to do is step up and assist them in this fight and remind each other. I also actually do get reminded, put on your mask, put it on correctly. And that's what we need to do for our fellow Kenyans as well. Angela Okech has mentioned the issue of ensuring that measures are in place when it comes to limiting social gatherings. Again, we are here today and we've been here for, say, about 20 minutes. This is a social gathering in of itself. So what we need to do is, while we progressively move towards returning to normalcy, is to ensure that really, even when we are congregating, we have to ensure that we are maintaining the social distance as you are today. And I think in past briefings, the Cabinet Secretary has called on to Kenyans, including leaders, including our political classes, to be able to adhere to these measures. And I think in the coming days, again, we shall re-emphasize and remind people on what our guidelines state and why these guidelines are actually in place. And so in terms of who then is going to go around checking to ensure that people are adhering to these guidelines, the answer is you and I. It's you and I, because it's only you and I really who would be able to combat this. And so what we are calling on and really appealing, and we are going to emphasize going forward, is that there is a risk. And I think this was seen in different countries. I'm sure you saw what happened in South Korea when a man attended one, social gathering, or when a gentleman went to one club, the effect of that one super spreader event. And so really it's for Kenyans to really appreciate that at the end of the day, it is up to each and every one of us to take responsibility. There's an important question that Nancy has asked concerning Dadaab. Yes, indeed, you do appreciate that the very nature of Dadaab and other areas where you may have congregated populations poses a risk. That being said, like we've said in previous briefings, we are working with different partners, particularly the UNHCR group, who is there to ensure that measures are put in place to at least have measures of containment in such setups. And for Dadaab, one of the things that's happening is that I'm aware that they've really taken upon themselves to implement what they're calling the community health strategy approach in Dadaab. And so community health workers have been deployed within the camps, and they're able to actually map within the camps the households and the tents. And this is quite important because, again, it helps us even in contact tracing within such setups. With regard to the question you've asked, is this a contact of the previous cases? we shall be able to share that with you in the next briefing. I don't have that information with me right now. However, I'm aware that for each positive case that we obtain, there's actually a very intricate process of ensuring we are able to list each and every contact of that individual. And so this is information that we'll be able to share with you, perhaps in the next briefing, in terms of if these were actually contacts in the camp. And then there's the question that has been asked concerning releasing of asymptomatic patients and whether they pose a threat to fellow Kenyans. Not to sound morbid, but the fact that you're all standing there, one of you could actually be asymptomatic right now. Meaning one of you could be posing a threat to myself, to yourselves, and to us who are all here. And so really what we are saying is that looking at the cases, looking at the anticipated caseload, it becomes important to review our approach and to be able to come up with a hybrid approach that is able to, one, ensure the rational deployment of resources, but two, to ensure that for those who can actually ensure that they have isolation services in the home, then perhaps that is a more prudent use of resources. But at the same time, also understanding that we do have, to have country adaptation, we have to take cognizance into our environment, in terms of our high slum dwelling areas, to ensure that measures are in place. And so what you will see moving forward really is a move from isolation in health facilities towards a hybrid model where we are assessing, can you be managed at home? And if yes, how can we manage that? And how can we ensure that you're actually able to adhere to the measures in terms of home-based quarantine? And there have been very, very good applications and innovations. And there's actually one that we've made deploy. It's known as Jitenge, which is an application that is able to monitor how you're doing when it comes to home-based care. So that's one approach. However, we're also looking at seeing how can we utilize further community resources and centers to be able to have wananchi, perhaps, who cannot afford to have adequate home-based care, be quarantined in a community center. And this, again, is an approach that we shall share in the coming few days. I think I've been able to tackle most of the questions, but I'll ask Dr. Nandili to add in more.
Thank you, Cass. Ideally, reducing the number of patients in our facilities is very important to us. Having over 874 patients in 50 hospitals is a challenge to the healthcare workers. And therefore, that's why we are introducing home isolation and the other measures, as Cass has mentioned, so that we balance the care of patients both at home and at the healthcare facilities. In addition to that, probably I would wish to acknowledge the good work our healthcare workers are doing all over the country, and may they maintain the same spirit and let them keep supporting the patients in need as usual. Thank you, Waziri.
Thank you. Thank you all.